As a bank that focuses on business, we work with business leaders all day, every day. We have a front row seat to what's working and what has potential. The First Business Bank podcast is dedicated to sharing insights to help you work better, smarter, and faster to achieve your goals. Let's get into the show.
Hello and welcome to the First Business Bank podcast. I'm Kevin Kane and I'll be your host for today's episode, the Renee Ramirez story, starting a nonprofit dental clinic. To help tell this story and share some details about a remarkable journey, I'm joined by Renee Ramirez, CEO of Community Smiles and a First Business Bank advisory board member. Renee, thank you for joining us today.
Thanks for having me.
I appreciate it. So to start, for those who may not be familiar with Community Smiles, can you sum up the mission of the organization for our listeners?
Absolutely. Excuse me. Our mission is to improve the lives of the underserved through oral health care services, preventive education, and advocating for systemic change because everyone deserves a healthy smile.
Terrific. And the other thing, Renee, maybe to kind of provide us with some background would be to tell us a little bit about what you were doing before you started Community Smiles.
Well, for 16 years, I was the business director of a nonprofit preschool that operated out of churches throughout Waukesha County. It was a part-time position, and it allowed me to be a full-time mom and a community volunteer where I gained a lot of expertise in being on a nonprofit boards as well as fund development.
Based on that background, Renee, what was the spark for you to make that transition? It wasn't necessarily an obvious choice based on your background. So what kind of was the connection for you to switch over then and begin Community Smiles?
In 2007, I was challenged with public schools offering a 4K program that competed with the nonprofit model that we were running out of the churches. In order to balance the budget, I wrote myself out of the budget and started to look for a job. At the same time, I had some friends that were participating as members on the Waukesha County Dental Coalition, which was charged with coming up with a solution of how to find dental care for children whose parents or who have Medicaid insurance. They knew about a job that was going to be posted, and they asked that I consider applying for the job. And of course, I said I don't know anything about dentistry, but my interest was piqued because I'm a problem solver, and it just didn't make sense that children didn't have access to a dentist, even though they had insurance that would cover it. So I applied for that job. I really didn't think I was going to get the job, but it was a great exercise in putting my resume together and interviewing, and lo and behold, I was offered the job, and the rest is history.
Okay, so and when I think back to that time period, this was really kind of in the depths of the Great Recession, and to make that sort of a pivot, to make that kind of a change, that takes a lot of courage. So. And starting from scratch too, it wasn't, there was a need that you had identified and the folks you were talking to had identified, but tell us about the early days. How did you get it going? Was it smooth right out of the gates? Did you ever have moments of doubt? Again, that was a big choice and a big decision for you at a point when the economy wasn't doing so well.
Yeah, indeed. When I was hired, there wasn't even a job description for my role. There was a great business plan that the inaugural board of directors had put together with the help of Waukesha Memorial Hospital Foundation and their legal team, and I'm very grateful for the partnership that that organization provided us. But I had nothing. I had an office space that Waukesha Memorial Hospital Foundation, which is now Pro Healthcare, offered me. I didn't have a computer. I didn't have a bank account. I didn't have credit. I didn't have an email address. So I literally had to start everything from scratch. And I didn't want to use my own resources to buy a computer. So I don't know how I came up with this somehow it came to me that I needed to get a cashier's check to go buy a computer so that I could get at least the ball rolling, because I needed to establish this concept as a 501c3 that didn't even exist. So it was some rocky, bumpy roads in those first couple of months. Really try to navigate where I needed to go. We had a building to create this dental clinic, but there was not a plan. There was not architectural plans. So I really worked very hard to pull together a team that would help me to create the architectural plan for the clinic, but also then to continue to raise money. And again, Waukesha Memorial Hospital Foundation and their team helped me understand how to write a grant, how to raise money. And with their help, we raised $1.6 million to get things off the ground. This role was supposed to be 26 hours a week. And I was not accomplishing what I needed to do in 26 hours. And after 2 months, I went to the board at our board meeting and I said, I think you picked the wrong person. I'm just not able to execute everything that needs to be done to stay on this timeline. We were planning to get the clinic construction project started in January. This is October. I just don't think I'm the right person. They excused me. They went into executive session and they came back and they said, "You're right. We underestimated how much work this project is, and we will transition you to a full-time status." And I accepted the job.
Okay. So that was a pivotal moment, and your ability to come forward and speak the truth and let them know, and you must have been doing something right that you had that support. And you've got me thinking as well. It kind of, you've touched on some of the folks that were helping you in the early days, beyond the different board members. Takes a village to help get an organization like Community Smiles off the ground. Who are some of the other key partners in the early days that made a difference for you and the organization, would you say?
Well, then and now, our organization has been supported by the community. So early on, it was organizations like our school districts, the county, Rotary service clubs. The Waukesha County Dental Society was key in helping me understand what it takes to run a dental practice, because not only am I running a nonprofit organization, I'm also simultaneously running a dental practice. So it was their expertise that allowed me to understand how to not only build a dental practice, but also operate. There are things that, in terms of the earned revenue, the staffing, OSHA, bloodborne pathogen protocols. I mean, all those things I didn't have access to prior to this position. And it was through their guidance and mentorship, we were able to put a successful dental practice together.
Okay. And I'm also thinking about the talent, the dentist, the dental professionals themselves. Can you talk a little bit about how you went out and recruited those professionals that joined you in this effort and were the ones that on a daily basis were taking care of the children and your clients?
When we opened in 2008, I had one dentist, one hygienist, one receptionist, and a couple of dental assistants that, assist the dentist. And through I think just outreach and participating as a associate member of the Dental Society and talking with our Wisconsin Dental Association, Marquette Dental School, it was alerting them to the opportunity to work in the public health sector that has allowed us to recruit and retain some awesome dental providers over the years.
And is it, for our listeners, are these all volunteers? Are they paid positions in terms of the dentists and the assistants and that type of thing?
So our model, and I'm very grateful to the group that wrote our business plan. It does allow for us to have a paid staff model and supplemented by dental volunteers. So the majority of our team are paid dental providers, meaning dentists, hygienist assistants. And then we have also supplemented with dental volunteers, many who are retired dentists that don't want to give up dentistry.
Got it. And as you think about, again, those early days, how did you get the word out to, I'll call it your constituents or the people that you were there to serve? Was that difficult to do? Did the good news travel and there was no issue in terms of finding patients to help and that type of thing?
Well, I was the only individual that was able to leave the clinic walls. Everyone else was there to do their job. So it was really up to me to get the word out. So whoever would allow me the opportunity to bring the good word about the work that we were doing, I was there and made my presentation. So it was not only the service clubs, but it was the county agencies that were also supporting the same patients that we were serving, the school district, the school nurses. It was you can understand why it was not a 26-hour per week job. I was working 40, 50, 60 hours a week. Early mornings to late evenings get the word out. But it really took off because I think we had such a positive environment that we offered and a great staff that cared for our patients. And it was just word of mouth, actually, that has helped tell our story. And we didn't have the same opportunity when we opened our second clinic in Menominee Falls because they were no longer school nurses. So the efforts really, the effort to get the word out was more difficult, but I also had more team members to help get the word out.
Okay. And I was going to ask you about the second clinic in Menominee Falls, and in a way you're touching on something I was also thinking about, which is how has your mission, if I can use that word, evolved over time, and what was the catalyst for going down the road, I'll call it, to Menominee Falls to open the second clinic? Tell us a little bit about that.
So our mission continues to be the same as we adopted it in 2007. We continue to reevaluate it every couple of years, and we are still here to provide access to affordable dental care for those who are underserved. In the course of doing a community health assessment, which is done every couple of years by our healthcare systems, Freighter Health identified dental as continuing to be one of the top needs in their service area. Freighter reached out to me in 2017, asking if we might consider opening up a second clinic in Menominee Falls or surrounding area to provide services to the patients in their service area. We had just finished a strategic plan that outlined future growth, and so the timing was perfect. We were able to say yes. And we were funded with a very generous grant to not only rent space, but to also build and open a second clinic in Menominee Falls.
Terrific. And that has me thinking about, as you look ahead, so that was about 5 years ago. So if you look to the next 5 or 10 years, Renee, where do you see the organization going from here? So you started 2008 in 2017 with Freighter's help and discussions there. You opened the Falls. Where do you see the organization going?
In early 2022, we saw an increase in demand for our services at our Menominee Falls clinic. In just 4 years, we were at capacity. And as we evaluated the need, we see that there is actually more to do for Community Smiles Dental. So my vision is for the next 5 years is to grow our organization into Milwaukee County.
Got it. And I can imagine, to be able to scale up like that, you'll have plenty to keep you busy. It would seem to me just that there is so much need across all of the different areas in Southeast Wisconsin, but I can appreciate that perhaps in Milwaukee County in particular, there's more work to be done as well. How does that change your funding model, if at all? You bootstrapped it in the very beginning, then you added Menominee Falls. Now for the next chapter in this journey, that to me seems like a much more significant scaling up. So what are your thoughts on that aspect of the effort?
So Good question. To give you context, right now we have a $3 million operating budget, and of that, 60% is contributed revenue. The other 40% is Medicaid reimbursement. So 60% is about $1.8 million, and we've been successfully raising those dollars every year. And we know that in order to grow the organization with a third clinic, or more, we would need to really beef up our fundraising efforts. So what we have just created this year is a growth plan. It's going to be in phases. And in order for us to grow into another space, we also know that we have to grow our administrative infrastructure. Right now, we have a very lean, means fighting machine, as I say, and have just created additional roles that will help us raise more dollars.
Got it. I was also thinking about, and in a way, you're well prepared for what I'm reflecting on now, which is interest rates are heading up. There are signs the economy may be heading into a recession. With all of that, and I suppose it's not simply about Community Smiles, but entering that type of a more challenging economic environment, how does that affect those funding efforts and raising dollars to support not only where you're at today, but to move forward with that next step that you described?
I believe we've done a really good job educating our donors and our partners and constituents in our communities about why oral health is important. So as we do have the recession, I'm not fearful that we won't be able to raise those dollars, but it really will take a very strategic effort to make sure that our message continues to move forward, and we have plans to do that. We're actually right now working on new messaging for next year and the years to follow. So I'm not concerned about that, but I do anticipate that the need for our services will increase. We saw that in 2008. I see that now. I also see those individuals who might be on the Medicaid insurance because of the pandemic will lose those resources and will become uninsured. So the need for our services will continue to be needed.
Got it. And maybe to your point as well, Renee, right? It may actually amplify the need as perhaps some areas of our community struggle. Coming off of COVID, I can't imagine how difficult that was to deliver services and do what you needed to do during that period of time. So, but you've proven to be very resilient and I suppose tested by different things. And this will be just one more thing for you to kind of work through. What would you say as far as well, let me ask you this. What does an average day look like for you, Renee? You described kind of early on, not enough hours in the day. You were doing everything soup to nuts. But at this point, what's a typical day or a week look like for you personally?
My role has definitely evolved over the last 15 years from managing all of those activities that I, mentioned earlier, to now being more of an external representative of the organization, where I'm working to develop and steward donors and other partners who will help us do the work that we do. And I'm also continuing to be that advocate that works with our local and state legislators to ensure that access to oral health care doesn't go to a deaf ear.
Got it. And as far as anything else what else haven't we covered? Let me ask that question.
Yeah.
What else haven't we covered that you'd like to share with our audience? Things that maybe they should know about Community Smiles that we haven't touched on so far?
Well, I would be remiss if I didn't mention that we have an annual fundraiser, Laugh for a Smile. We laugh so others can smile. It's April 20th of 2023. It's our 15th anniversary. It's going to be quite a gala. So I would invite our listeners to visit our website, which is communitysmiles.org, to learn more about the event, sponsorship opportunities. We also have wonderful testimonial videos on our website that would give you a little bit more of a patient story perspective. We also every year have a smaller networking fundraising event we just did last week called Cheers to Community Smiles. It's a wonderful event, so that would be something we invite people to do. We also would truly love to provide tours to anyone that might be interested to get get the real-time experience of how we operate and why people are so eager to come to us. And we would also ask for people to continue to support us with donations and or volunteer their services. And I would also remind everyone to visit your dentist and hygienist on a regular basis because prevention is key.
Got it. I saw some statistics before about how many folks you've served over the years, and it was a pretty staggering number. So can you? I might get it a little bit wrong. So tell us that little fact.
That number is a moving target.
Sure.
So more than 25,000 individuals have been serviced or been cared for by Community Smiles Dental over the last 15 years. 14 plus years, almost 15 years. And in terms of the total care that we provide, $30 million of dental care has been provided throughout those years. So pretty staggering statistics.
A remarkable, testament to the purpose of your organization and the impact that you have had in so many ways, not to be underestimated by any means. So now this is an interesting question that I was reflecting on. I mentioned, Renee, at the start of the podcast that you are on our advisory board here in Southeast Wisconsin for First Business Bank. But with that perspective, can you share any thoughts on what other nonprofits should consider when they're looking for a banking partner? What are some of the important aspects of a banking relationship that, based on your many years of experience, are important to consider?
Well, I would recommend, as you said, the word partner, finding that right banking partner. And with First Business Bank, I know I have not one, but many partners who help support the work that we do, that are fiscally responsible with the deposits and investments that I have made with First Business Bank. But I think the key theme and key word that I would recommend searching for, and it would be partner.
Got it. Well, Renee, thank you so much for being with us today. I really enjoyed our conversation. And any final thoughts for the podcast here for folks that are going to be watching and or listening?
Just thank you for joining us today and your interest in learning a little bit more about what Community Smiles does to keep individuals in our communities healthy, at work, in school, able to eat, sleep, and learn and work successfully.
That's a good way to wrap it up. And so I would also add my thanks to our audience for listening, tuning in. And for those who would like to learn more, please visit us at firstbusiness.bank to check out other resources we offer for businesses, business owners and leaders, and nonprofits. We invite you to experience the advantage with First Business Bank, and we are here to help. Thank you.
If you want more content like what you just heard delivered straight to your inbox, go to firstbusinessbankpodcast.com. And if you haven't already, make sure to subscribe to the First Business Bank podcast wherever you listen to podcasts. If you're listening on Apple Podcasts, please leave a quick rating of the show. Thanks so much for listening. First Business Bank, member FDIC.